time. So what we are doing first is to cut longitudinally at the mandibular level, as you can see here, just signaling with the knife, making a kind of triangle until the meconian area, and then we will cut the skin until the entrance of the thorax, and we will open completely until the ischiopubian symphysis. So the procedure is as easy as that. So I make one triangular cut in there, so the cuts are very easy to be seen, and then just with the knife I can separate the skin in a very gentle manner until reaching the entrance of the thoracic cavity. In order to proceed for the opening of the thoracic cavity, sometimes we are using what we call the costotom in order to cut the costal wall, so the ribs. However, instead of cutting the ribs by the bone, we will try to cut them by the cartilaginous area. So the point is try to cut, as we can see here, at the cartilaginous area. And first of all, I have been opening just the thoracic cavity, but this is a procedure that can be performed very fast, and then open as well the abdominal cavity. At this stage, we have a vision already of the thoracic and abdominal cavity. Imagine for a while that we are in front of a process like polyserositis, fibrinous polyserositis, and we are potentially interested in taking samples for microbiological analysis. This would be an excellent moment to take the sample. And what we recommend is to take liquids in case that there are liquids in the different cavities, but if there are no liquids and there's just fibrin, then a SWAB can work very well. So the possibility of taking a SWAB, of course, as you can see, we have not touched at all the thoracic or abdominal cavity. Of course, with a different one, we will do exactly the same for the thoracic cavity, but then the sample is there and it's ready to be submitted to microbiological department. Of course, we will have to note and annotate all the data from the animal. Okay, at this stage, it's very important to see if all the organs are in the right position and in the right situation. As you can see, the abdominal cavity, you always see the liver. Sometimes the spleen is not observable because it's still covered by some of the intestinal loops. We have the urinary bladder, here we have the cecum, and mainly a small intestine. Well, first of all, we like to take from the tongue, following the trachea, esophagus, lungs, and heart as well. So first of all, what we do is just to cut the muscles around the tongue. So we are just doing this kind of separation, and the most complicated area is to separate in the Mentonian area. And in the Mentonian area, for example, we can use my own finger, make some pressure, and then to try to cut the tongue. So at that way, I'm separating the tongue, and I'm reaching one area which is very important in pigs, which is the oropharyngeal ring. In the oropharyngeal ring, we have one very specific area that I would like to show now, which is the tonsil. The tonsil is visible just there. It's the soft palate, and you will recognize it because there's a punctiform drawing which corresponds to the tonsillar crypts. So from this point of view, I would like to emphasize the tonsil, because the tonsil is a typical place of replication of different viruses, which are in general terms of systemic or sometimes respiratory effect, or even different kind of bacteria. So this is an area which is also especially important when we are dealing with important diseases like African and classical swine fever. But anyway, it's important for PRRS, it's important for the other viruses like PCV2, but bacteria like Actinobacillus pneumoniae, Haemophilus pertussis, and so on. But anyway, you will recognize very easily because of this punctiform drawing that you can see here. So what we are doing here is to remove the tonsil together with the tongue And then we are just separating in a careful manner the trachea, the esophagus, and I'm just progressing towards the thoracic cavity. The way of opening the thoracic cavity is relatively easy in a small animal because at the very end the joint between the two thoracic walls is cartilaginous, so I can cut very easily from that way. And even this is not nice, but it works very well. I separate both thoracic walls by just making this kind of a fork. So now I can separate it. I'm just cutting for one side and for the other and try to take the whole cardiorespiratory tract out. As you can see here, sometimes I'm just working with the finger, not necessarily with a knife, and I'm able to remove all the attachments of the respiratory tract into the thoracic cavity. So as you can see here, we have the lungs. Then I will just cut the very final point. Of course, one issue which is important is that we will have the esophagus. I try to cut the esophagus as far as possible from the cardiac, basically because if there's any content in the stomach, to try to avoid to get it out. In general terms, the cardiac is a kind of a sphincter, so in general terms, it also prevents that. So I'm just cutting, and at that way, I'm separating the whole cardiorespiratory part. We will leave this apart, and we will discuss afterwards. So now it's time to go for each of the tracts or areas or tissues that are of interest. Of course, here we will follow them up, all of them, basically because this is a normal animal, but just to give the tips of what we should go for. Here we will start for the cardiorespiratory system. Our recommendation is never to separate the lungs from the heart. Basically because we are interested to see if there's no kind of alteration, especially in the joint part of the big vessels that are going to the heart. Because if we are cutting directly, then it's very difficult to see anything. It's true, however, that in pigs, pathology, cardiac pathology is not that frequent, and this kind of alterations are not really common, not at all. So from this point of view, we will follow up together. And first of all, and very important, is to pursue the tonsil. If you remember, I told you that the tonsil was removed together with the cardiovascular tissues, and what you see here is the soft palate, and the soft palate is just the tonsil. So as you can see here, you have both tonsils, the different pinpoint areas that I indicated before regarding the crypts, and this is an excellent sample, especially if we want to study viruses. So sometimes it could be an interesting tissue for doing PCR. So if we are interested in doing PCR sometimes with a small piece, this is a really big piece, but anyway, at the necropsy we can take big pieces and send to the laboratory, and this can be submitted just in refrigeration or even frozen, depends on what you want to do. Secondly, we want to study everything in here. This means that we have the esophagus. So what we will do first is to separate the esophagus. As you can see, I'm doing here carefully. We have the esophagus at this part together with the aorta, but look that I'm just separating it. And then I will open it longitudinally, because at the very end in the esophagus is not expected to find any special problem, but it's always interesting to be sure that at least it's normal. So we can open from the caudal part or from the cranial part. So this is irrelevant, but we can open it longitudinally. And we can see that the mucosa is white, is absolutely normal. There's no alterations, there are no different areas in color or something like that. So this is absolutely a normal one. Then we are interested in studying the respiratory tract by itself, which is the trachea and the lungs. However, the observation of the lungs is extremely important, especially in order to foresee potential lesions which are compatible, of course, with different diseases. When we are talking about bacterial diseases, we know that mainly The distribution is cranioventral, so affecting apical and middle lobes, sometimes the cranial part of the diaphragmatic lobe. When it's viral, tend to be more widespread. In general terms, we are talking about interstitial pneumonia. Interstitial pneumonia is typically seen when we have tan-mottled lung, lack of collapse, and interstitial edema. However, not always is seen. While in bacteria, in these particular areas, we are talking about suppurative bronchopneumonia. We have some kind of a special lesions sometimes, like bronchointerstitial pneumonia or pleuropneumonia. However, in all cases, when we are talking about sample taking, we have to think in what we suspect in all cases. In our hands, what we prefer when it's a matter of bacterial isolation is to provide the whole hemilung to the microbiology department. So from this point of view, what we do is to take it as a whole, one lung. Of course, the one that presents the lesion, because it's very important for the microbiology department when receive the samples to burn the corresponding surface, to open, and then to try to retrieve the corresponding bacteria. So this would be an excellent sample to be submitted to the microbiology department, even it's big enough in order to be sure that we can avoid contamination, because at the very end, as I told you, they will be burned. This is completely closed, and importantly, it will have to be annotated. We always recommend to take samples of the apical and middle lobe, as well as the diaphragmatic lobe. However, especially on the cranial part, even for viruses which is much more distributed, except for influenza. In influenza is also much more cranioventral. But what we do usually is to discard the apical part and take one piece, as you can see, relatively easy to see and not very wide in order to facilitate fixation. So this is the part of apical. We do the same with the middle. So we discard the tip and we take another sample of lung. And finally, the diaphragmatic part. For the diaphragmatic part, it's very easy to do this. But this sample is useless, almost, because it's extremely difficult to find anything there. So we always prefer the cranial part, and one possibility would be to make a cut that way in order to have also diaphragmatic lobe. Of course, we can take as many pieces of lobes as we want. It depends on you. Also for PCRs, if you are interested in detecting especially PRS virus or swine influenza virus, etc., sometimes, of course, the ideal is the cleanest material as possible, because this is already contaminated probably, and to take small pieces, with really small pieces that even you can indicate in a practically a small tube or even in a swab. A swab can perfectly work. Another thing that we have not already observed is the trachea. So if we want to open the trachea, we did it longitudinally, as you can see here, until reaching the big bronchi. It's not very usual to find pathology in the trachea of the pig. Okay? So this would be for the respiratory tract in order to take samples and to do the corresponding observations, but we still have the heart. And with the heart, as I told you, we used to leave it here, especially because in order to see if there's any type of potential affection of the big vessels. In general terms, this is not the case in pigs, but that way we can look at it, and even we have still the lungs here, so it's relatively easy to manipulate. How do we open the heart? The easiest way is always to follow the blood flow. And for example, this means that we are going from the cava vein, just I'm entering the cava vein now, until the right atrium. I'm just doing an L-shaped cut, and by doing so, I'm just opening the right atrium. Of course, is plenty of blood. We will remove the blood afterwards. And then, after making such L, I'm going to the interface of such L and put my scissors again just over the interventricular wall. And then I'm just cutting following such interventricular wall, until, of course, when I'm getting out, as you can see here, by the pulmonary artery, which is perfectly seen here. So by that way, you will see we have opened the heart. There are some papillary muscles that I'm cutting. There's plenty of blood, so we can remove the clots without major problem. And the most important visualization here is the atrioventricular valves, you can see here, and also the valves of the aortic, the pulmonary artery, as you can see here. Okay, this looks normal, and then we will do exactly the same with the left heart. So here, what we will manipulate, it will be the pulmonary veins. So I'm cutting the pulmonary veins. I'm just entering into the left atrium. I will do again the L shape, so cutting there. So I do this L shape, and then again in the interface in the L, I will go into the interventricular wall, and I will cut again, following such interventricular wall and getting out from the aortic artery. In fact, look at the scissors in here. I'm just cutting, I'm going out for the aorta. So here we see the aorta, we see the valves of the valve, and we can see as well the clots that we can remove, and we will observe the atrioventricular valve. In general terms, this looks normal, so it's not a problem. And in case that we need to take some samples, especially for histopathological analysis from the heart, what we recommend usually is a piece of the ventricular wall, again, a small piece that we can fix easily in a formalin can, and sometimes also a small piece of the atrium. So at that way, we have both a piece of atrium and ventricle.